Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie, and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. For this episode today, I have the honor of speaking with Dr. Daria Waszak, Associate Dean of Nursing and Associate Professor at Felician University here in New Jersey. Daria, thank you so much for joining us today.
Thanks for having me, Stephanie. It's a real honor to be here.
Thank you. So to start off, could you just share with us a little bit about your journey just into the nursing profession?
Sure. Let's see. Way back, I had no idea what I was getting into when I first entered the nursing profession. I thought all I did is give vaccines or injections. That's really what I thought it was. Because as a kid, I had allergy shots. And I remember the nurse was really cool. We would compare tans and it's like, oh, she was this cool nurse. I want to be like her. Had no idea what I was getting into because I really had no exposure to the medical field or the hospital side growing up before that. And wow, what a world to enter. And there's so many pathways to specialize in.
That's such a beautiful story. I think it's so telling of the nurses you encountered, and then the nurse you become from just having that experience of getting to see what the profession is and then saying, I'm going to be a part of that. I love that. So when you started off your career, you were within the hospital setting, or was that the first time?
I don't have a traditional journey at all. I really started out in family practice, and then I did a little bit of home health, pain management. Then I went into an emergency setting. Then I did forensic nursing, and then I ended up in occupational health. And when I was in the emergency setting, I really thought this is where I ultimately want to be. This is where I strove to be. I really wanted to get that certification as an emergency nurse, which I did. But once I got there, I just realized I don't know if I want to spend decades in this role. And I saw so many issues that I thought if I can go back and study and be an administrator or a leader, perhaps I could influence these and create some change here. So then I ultimately went back for my master's degree at that point when I was in that environment.
And then from your master's degree, you continued on to your DNP.
Yes, and then I ultimately went for the DNP as a terminal degree because I wanted to go into teaching. And that worked out, kind of helped open the doors for me to enter teaching.
Yeah, could you tell us a little bit about what drew you into teaching from the bedside into the teaching aspect of nursing?
It was really all about family. At the time, I wanted something more flexible for my schedule. And when I was first applying, I wasn't in a doctoral program at that time and wasn't having any luck. And once I started pursuing my doctoral degree and I continued applying, and then I finally was given a chance. And it's hard when you're new and trying to do something new. And then everyone's looking for experience, right? And it's like, you got to get that chance to get for your first time to show you can do it. So I started as an adjunct, which is a great way to kind of enter the field too. So I started as an adjunct, and after one term, they offered me a full-time position to teach.
That's wonderful. And you're saying, so you were teaching while you were in school, and that was actually possible?
Yes. And that's the great thing about teaching being so flexible. And it's also great because whatever I was learning, whether it be advanced evidence-based practice or policy or whatever it is that I'm learning in the classroom, I can immediately apply to my teaching. And it made it that current and relevant. And then you learn it that much more as you're teaching it. That was really good.
And you were also teaching, you have been teaching at multiple levels, from the undergrad all the way up to the doctorate level. So that is amazing. What are some of the great parts about teaching? What are the things that you love about your job?
Some of the greatest days that I have where I come home and it's just really rewarding is being able to make a difference in students, especially students who maybe they're first generation college students or coming from a vulnerable population, and being able to see them transition and grow as a nurse or grow into a new level of their career. Or if they come back and reach out to you after graduation and you kind of maintain that relationship, those are the moments that are really the most rewarding.
I was one of the nursing students that fell into that demographic. So I thank you for having a heart in particular for us nurses who are really navigating the system for the first time, maybe without a family member or somebody to guide us. I mean, it makes such a big difference to have nurses who are willing to be mentors, willing to, just be a support system, because we really are a community as a, community of nurses. Was there anything in particular that was surprising for you coming into teaching?
One of the most surprising things was how quickly things change. And you think, oh, how hard can it be just teaching a class? But textbooks change, content changes. It changes as quick as it changes in the clinical setting. You have to keep it relevant to try to minimize that academic to practice gap. So that was one of the most surprising things to me, is just how rapidly, just how much work you really had to put in to keep your course going and keep it relevant.
I know that there probably is quite a lot of creativity involved in keeping curriculum up to date and keeping students engaged. You had a chance to share with me before this conversation a bit about a course you developed. Would you mind sharing about that?
Sure. It was an interprofessional course. What allowed me to bring something from my work experience into the classroom, which was forensic nursing. I came upon a model that Fairfield University used, and they partnered with us to apply it. And we adopted it because what it was is that we combined criminal justice, chemistry, and nursing together for them all to learn in an interprofessional format how to respond to a crime and what all of their roles are as a team. And so we have a simulated kidnapping, and there's different labs and different pieces that they all work as a group to solve. So that was really rewarding too, to see that come together, and the students love it. And so we're going to be, it just ran for the first time this fall, and it'll be running again in spring. And it was already over enrolled, so we had to open a second section. So it's really exciting to see everyone interested.
Do you mind sharing with us just even your thought process in coming up with a class like that, or structuring it over the 15 weeks or so?
For an elective, it's a little bit different, but really everything is connected to your course objectives, and your course objectives are connected to multiple aspects: what the needs are in the healthcare setting, what your community needs to ensure that healthcare is provided in a safe and a quality manner to your population, and also what the standards dictate. Schools are accredited by different agencies. A popular one is CCNE, and they have standards that you have to make sure you're meeting with your curriculum. So it's all like a puzzle. But ultimately, what's most important when you look at a course is course objectives, and how are your students meeting your course objectives? How do you assess mastery of those objectives? And how can you do so in a really innovative and engaging way? You want your students to be engaged. You don't want them just reading through and learning at, we have what's called the Bloom's taxonomy, and there's different levels of learning, right? And you don't want people just repeating or just knowing or just understanding. You really want them developing, creating, really integrating, synthesizing. So you have to think of ways to create assignments to allow that to happen, that learning to happen.
That is so fascinating. I feel like we talk about how nursing is an art and a science, and it seems very much to intersect there again in the curriculum and the development of how to teach young minds and how to get folks into the profession. We spoke briefly before about how you taught at different levels. Was there anything interesting teaching from the undergraduate level up through the graduate level that you found was different amongst the different populations?
There's a lot of differences, and it also depends on the delivery of your course, whether it's in person or online. And I've taught in both delivery models and hybrid as well. And I've taught undergraduate RN to BSN at the master's level, postmaster's certificate, and doctorate. And some courses I've taught at all levels include topics covering research, health policy and ethics, as well as informatics. And it really kind of builds. The higher level courses are going to have more complexity, are going to go into a little more depth, help you learn how to apply those principles in a more broad way and at a systems level. So that's how it differs.
I believe I've seen that you've also taught online versus in person. Do you mind sharing with us about how that's a different avenue as well?
It is really so different. The fully online setting, you really have to put so much into your course, particularly beforehand, so that your course is ready to go. And you have to have attention to detail, because if you miss something, the students will catch it. Whether it's something, you have to make sure, right, the assignment's labeled the same way here as it is here in the syllabus, as it is in your grade book. So everything really makes sense to the student, and they're not sitting there wondering if they're missing something. So you want to make it as organized and clear and concise as you can. A lot goes into that, even more so than teaching in class setting for a fully on, and not everyone is necessarily cut out to be teaching online. You might be more suited to teach in person. And we find that too. So some people entering nurse education kind of have to see what the best fit for them as far as teaching.
And I know we talked about how Felician is a smaller university, and that was a good fit for you. Could you tell us a little bit about working at a smaller university and being a part of the community there?
One of the best things about Felician is the mission. And I think no matter what career path you have, whether it's in healthcare or outside of healthcare, looking at the mission of the organization is crucially important, and making sure that your values align with that institution. And I think for some institutions, maybe mission isn't carried so heavily, or core to who they are, but at Felician they do. And so that's really exciting because it's more meaningful when everything that you're doing is connected to mission. So I find that to be inspiring. And also working for a smaller institution, you really have the ability to influence change just a little bit simpler. You don't have so many layers of bureaucracy, right, to go through every time you want to make a change in a course or perhaps develop a new course or launch a new program. That's great too for those of us who like to be creative and innovative. That smaller academic setting is nice.
Would you have any advice for somebody who is considering either going back to school and then pursuing a degree that would allow them to teach, or somebody who has that degree and is considering teaching?
Having a master's degree in nursing could be enough. And sometimes you just have to be in the right place at the right time, knowing when a new program is being launched, or perhaps a lot of positions may become available because of something that's happening at the university. So you don't necessarily have to have the doctorate degree to teach, although it's always ideal. I was saying earlier in the podcast, it's just great to always think about it now. Don't think of teaching as something that you have to wait to do. And the scheduling can even be flexible, whether you're an adjunct or just a clinical instructor, that it can work for your current schedule. So it is possible that something like that can work for you.
You have anything to share about maybe folks who are feeling imposter syndrome, or like what you were saying, maybe I should wait till I have more years under my belt, but do you have anything to share with folks who might have that train of thought?
Well, for me, and I know a lot of people grapple over which doctorate degree to pursue, and the DNP degree for me was just a little bit more within reach and not as daunting, because you don't have to necessarily perform your own original research, although that's appealing and fun and attractive as well. But the DNP degree is a practical degree, but what's often missing in those curriculums is courses that teach you how to do curriculum development, curriculum evaluation, those academic type courses. So coming from the DNP degree and going into teaching, I decided to take a review course to get my certification as a nurse educator. And in that review course, I learned some of those principles, and then I was able to pass that exam. So that helped me with that idea of imposter syndrome. Just, am I qualified to do this? I have a DNP degree. I don't have formal training and education per se, but I was able to kind of just feel like I'm more prepared by taking those steps.
Yeah, and that makes perfect sense. Just like within nursing, there's so many paths to get to where it is that you want to work. There's so many places that you can go in order to get that experience and get the education needed to be an effective educator. So that makes perfect sense. So for folks who are thinking that getting into school or paying for school, it would be a real challenge, do you have any advice for them?
There are always options. There are school loans, of course. A lot of my students have a tuition reimbursement program that they're a part of from their institution. Like a lot of, certainly the larger workplaces possibly have partnerships with schools that you can benefit from. And then there are, depending on the state, there are New Jersey State, and there's a national one too, a nurse repayment loan program. I'm not sure the details of it, but that's something worth looking into. There are programs out there that may be able to help.
What about mentorship? Were you able to either go to school and find mentorship, or would you have any recommendations for students who are maybe looking for that community or that mentorship in the process?
Mentorship is something that anyone can be a mentor and a mentee. And so I would recommend that to anyone at any point in their career, is to find somebody they can learn from, find somebody that they feel inspired by, and, just ask them to be your mentor, and let them know, have a conversation with them and let them know what you're interested in and get their feedback. Always inquire, always sort of turn the next page. Don't be afraid to take risks. If something doesn't work out, there's been some paths that I've taken that, like I was mentioning, going into emergency, I thought that's where I want to be. Well, it wasn't, and it might be for somebody else, but it ended up being great at the time, but wasn't my long-term plan as I thought it would be. So don't be afraid to take risks and keep looking to aspire to do something different. Being an educator is just a great way to give back to your profession and influence the next generation. So that's always, I think, something worthwhile to at least dabble in, at least a little bit.
As an educator, and speaking about this, looking to the future, where do you think the future of nursing education is going? Do you see anything on the horizon?
Well, we're looking at a lot of new technology all the time. We just received a grant at Felician that I'm a principal investigator for. We got almost $1 million to help update our technology in our nursing simulation center. And it allowed us to expand and update our resources and sort of apply them even beyond the four walls of our lab. So we're getting new mobile technology, high fidelity mannequins and simulation technology for doing like pelvic exams. suturing arms and the arms feel like that they have real subcutaneous tissue and the fingers move. So it's kind of like you're really suturing a real arm. So all of this stuff is pretty neat, just being able to see how quickly it's not like it was when I was in nursing school where you give an injection to an orange. things are a lot more advanced now. And that's always exciting to see how you can train nurses to be even better than you have trained in the past. So being a part of that is pretty neat.
I do know that at one point you were also an entrepreneur within this space, right? Is that something you would recommend if you see a nurse who has an idea?
I'm really glad you asked that because I think every nurse listening to this right now has an idea. All of us are in our day-to-day, and it may not even be something you realize but because just through your day-to-day operation, just think of times you think, why is it that way? Or every time you go, ugh, or every time you're going an extra step with something and you know how it can be better. And you think, why didn't they involve nursing when they designed this? Why didn't they involve nursing when they planned this? So that's why it's really great to be involved in design. And if nurses can have an opportunity to develop their ideas, I think it would be amazing. And you see when that does happen, there are amazing ideas that nurses have to make things more efficient or safer that nobody else could come up with because they're just not exposed to that.
And kind of linking this even back to academia, you said you're a principal investigator. Are you able to share a little bit about that?
Entering academia opens doors for lots of different activities that you may not have done before. For me, that was grant writing, performing research on teaching strategies. So right now I'm a principal investigator for an evaluation of an iPad initiative that we have, integrating iPads into the curriculum. And then I'm principal investigator of a grant that I mentioned, looking at improving and updating and expanding our nursing simulation center. Oh, by the way, another really interesting thing is looking at augmented reality technology and creating holographic patients. And so we're looking at exploring that too. So again, all this is just so ripe for research. There are always opportunities to study the things that we do, even in academia. And so that's exciting. There are a lot of really interesting opportunities. Also in academia, you can easily and are likely encouraged to sit on a committee, and that can sort of get you to network with and meet other people in the institution from other schools and other roles, and get you exposed to another aspect of academia. So that's good too. So it's not just teaching like maybe some people might think. It's really a lot more.
That reminds me of something that I would be told by my nursing professors a lot, which was if you want evidence-based practice, you have to go out there and be part of the research, whether you're involving yourself as a research subject, answering surveys, answering questions, or leading the charge by doing investigation. If you want evidence-based practice, you need to contribute to it. So I love what you're saying about getting in your ideas and working and finding out how we can make this whole process better for healthcare for all. Could you share some insight about being on a committee? Because that's not something I'm familiar with.
The committee that I've been on for several years is the Online Teaching and Learning Committee at the institution, and I serve as its chair. Prior to that, I was the secretary, and there's representation from the whole university and also our Center for Academic Technology. We help manage and help oversee and promote quality online teaching and learning. So any issues that come up within the university or best practices that we want to share, it kind of comes through our committee.
So are there just a variety of different committees across the nursing department?
There are a variety of institutional standing academic committees that have membership from all of the schools. So we have a School of Arts and Sciences, School of Education, and School of Business and Information Sciences. So we're all represented on these standing academic committees. And then there are other needs that come up that are a little bit more, maybe more temporary, like more like a task force or a committee that has a more distinct purpose. But there are many opportunities to get involved in academia with more than just nursing.
And that's very cool because then, like you were saying, with your collaboration with the chemistry and the forensic science departments, you have the opportunity to kind of bridge, not just keeping everybody in their own little silo, but really showing that the real world, you're out. Nursing is not its own individual field. Nursing is touching a lot of other professions. We interface with so many, we cooperate with so many. So it's great to see that in academia, it's also the case. We're out and about.
Absolutely.
And would you have any just stories that you want to share, whether about teaching, about nursing?
One story that comes to mind just because it's rather fresh in my mind is just the difference it can make, just even providing new technology to our students. We recently rolled out an initiative where iPads were given to all of our incoming freshmen if they're Pell eligible, and that means they have a certain financial status or need that they're meeting. Those individuals received an iPad through this grant, and just being able to see that impact that made, it even made one student really emotional and shared how much that impacted them having a disability and being able to use technology that promotes accessibility and that helps them live and function and learn in an easier way. And so just to be a part of that was really rewarding to see that.
And on the flip side, would you have any experiences that were challenging that you had to get through, and maybe what that was like?
Just like with any job in nursing or anywhere, there's always frustrations. If you're giving feedback to a student and they don't read it, and you can see that they're not reading it or they're making the same errors, that can be frustrating. You can't change everything, but you can facilitate, you can do what you can to inspire, to facilitate, to encourage. And not everybody can make it, but I think anyone who has the desire to do something enough will succeed. And I truly believe that. Just instilling that faith in students and seeing it happen means a lot.
And I can imagine that you have some of those aha moments with those students after kind of hitting a wall and then getting through it. You probably have those moments where you get over that mountain and it feels like $1 million.
Absolutely. Seeing those smiling faces at commencement is everything.
Oh my gosh, how wonderful. And then you mentioned before you do have a lot of alumni that'll come back and share where they are and talk about their journey.
At our institution, most of our graduate students are alums. And so that's great because they're coming back. And we also do our best to track them and see kind of where they go. And, some of our faculty have more personal connections with some of the alums and can tell us how people are doing. So it's great to see what they're out there doing. They're out there CNOs and entrepreneurs and consultants and practitioners. So it's great to see that.
Have you had the experience that where one of your students learned under you has come back to become, maybe not a Felician, but in general, has come back to become an educator themselves?
I've only been teaching 9 years, so I haven't seen that per se. Although that certainly could have been possible in that time frame. I haven't seen that from my
maybe one day
students. But I know one of my alum has had interest in going back to teach.
I'm sure someday somebody will be picking up the torch and continuing on as well.
I hope so.
And we need you, nurses who are listening, we need you to come back and teach. And one of the questions we like to ask all of the nurses that we have on the podcast, well, and especially for you as both a nurse and an educator, how is it that you take care of yourself? How is it that you go back and recharge?
That's such a great question. And I think as educators, we really need to model this for our students and showing that we can give self-care as well. And I have this acronym that I wanted to share that's turning into a teacher now, but there's a model. It's my favorite word too, or one of my favorite words, the favorite word, but a favorite word, which is grit. And so grit stands for, the G stands for gratitude. Just having gratitude and having that positive mindset can really promote self-care, I think. For me, every day I wake up and I'm alive, right? When you wake up, I guess you would be alive. I have gratitude for that, no doubt. And just being grateful for even the little things through the day, the way that the sunrise looks or the way that something smells, or just having just a little moment with your coffee, whatever it is, just to have some sense of gratitude. The R is for release. So having some sort of way to release your energy in a positive way. And for me, that's exercise. So having a regular regimen. I go to the gym regularly and I mix it up, do a little bit of spin class, do jogging, rowing machine, weights, and then Zumba. So I like to mix it up. And that's really important, I think, at least for me, to have that regular release. The I is being intentional. And that's just such a popular word these days, being intentional. But for this purpose, I think what I'm saying is just being able to manage your time with a sense of control. Having a sense of control will promote your self-care. What part of your life, what part of your schedule can you control? Let's make sure you have 2 hours here for just peace, another 1 hour here for reading, another little pocket of time here for studying if you're in school, whatever it is, to have that control. And then last, the T is for trimming back. If the G, R, and the I aren't working, trim back and set some boundaries. Especially for an online educator, it's not like you're clocking in and clocking out. It's not so clear cut your role. And you don't want to leave your student hanging if they're sending an email. It might be 2 a.m. You might not want to make that a part of your life, responding or putting too much on yourself in the weekends when it's not necessary. So just creating those boundaries, and maybe if you need to, at certain points, say no to something or trim back a little bit. So that's it, grit.
What a complete answer. That's a whole system. That's a whole routine that you can implement to make sure. I mean, and that is the kind of thing that we need though. I mean, that type of holistic, because we know that just taking an afternoon off is not going to cure the type of fatigue that comes from really putting your heart and soul into your work. So really being able to incorporate all of those elements is a beautiful way to make sure that you can be in it for the long haul, that you can continue educating, that you continue nursing, that you continue caring. So what an amazing acronym. I've never heard that before.
And it's important too, because as nurses, we always think of everybody else first, right? And then we're here encouraging those to go to become an educator. Many nurses already have multiple roles, whether they're taking care of their kids, their parents, their neighbors, their friends, and other roles that they may have. You have to think about yourself. You have to. I think it's a good way to go about it, especially just making sure you have that release.
And that also relates to another question we ask sometimes, which is just that if we have any nurse allies listening to the podcast, if we have any spouses or siblings or friends, children of a nurse, would you have any recommendations for them in supporting that nurse in their life?
I think just being patient and being able to understand whatever it is that nurse has as far as their schedule, whether it's 3/12s, they might be really tired that next day off. Like just being able to understand, you're not going to understand, right? Just being able to understand where you can give some space, because just being a little bit patient with the nurse on their schedule, their demands, that can go a long way.
Yes, I know that's a big part of it. I love how you phrase, just understand that you're not going to necessarily understand, because I mean, every profession comes with its own set of challenges, and nursing is certainly one. Your loved one may come back home after seeing something that they definitely didn't want to see that day, or experiencing something at work that drained a lot of their emotional bandwidth. So I think patience is probably, like you said, such an amazing way to show support, because it's a profession in which other people for those 8 or 12 hours are your primary objective is taking care of other people. And then when to come home and have to take care of other people, or not necessarily have the full capacity that you did prior to that shift, patience means a lot.
And they might want to talk about it a little bit and decompress, and they might not want to talk about it. They might need to have that release. And it might, when you think about that patience, give them that time to go work out or do whatever it is, take a walk, whatever it is they need to have their release.
When considering people who may go into education in the future, what kind of traits or abilities do you look for that you think would help them in their journey? Or do you think would make a good educator?
Probably a lot of the same traits that make a good nurse, because what comes to mind is being organized, always looking for the evidence, being compassionate, and having some attention to detail, and also being willing to learn and adopt new technology. And that all applies to any nursing role, I think.
That makes perfect sense in continuous learning, because I mean, that is a part of the nursing profession. And even more so if you're at the forefront of nursing education, continuous learning is probably one of the most paramount, highest priority topic items there.
Absolutely. As an instructor, you'll have some responsibility there to keep the content current, and you don't want it to get rusty, and look how quickly things change in the healthcare setting. So it's important to be able to stay relevant, stay current, so that you can ensure your content does as well.
And Daria, speaking about leadership, are you involved in any professional organizations?
Yes. Let's see. One of them is the New Jersey State Nurses Association, NJSNA. I encourage all nurses, if you're not already a member, to do so. They have a low rate for nurses in the state, and they do so much for us in advocacy, promoting our profession. The other one is Organization of Nurse Leaders New Jersey. I volunteered to be a part of their public relations and marketing committee, and that I've learned so much about the organization and meeting other people. It's been fantastic. And last, one really great thing that I helped inspire with a change. I was a webmaster actually first with our Sigma chapter with Felician, and it was a at-large chapter with 2 other institutions. And we realized we really wanted to have our own chapter because our nursing school is growing, and we really wanted to have our own chapter. So I served as our inaugural president and helped us charter our own chapter. And we did that last May. So that was really exciting to help form our first board, induct our first class of inaugural members, and try to create a chapter that's very active so that Sigma members have an opportunity to learn how to become leaders, to get an opportunity to learn more about scholarship, and to be involved. Not just, oh, yes, I'm a member of Sigma and I wore the purple cord at commencement, but really feel like they're involved. So that's one of my goals this year, is to get that chapter up and running and get lots of opportunity for engagement for our members.
Congratulations. What a cool opportunity. And also, then if you don't mind sharing, do you have any vision? So once your Sigma chapter is established and once it's been going for a couple of years, what would you want a successful active chapter to look like?
Just being able to see it grow and being able to see all students, no matter what their pocketbook looks like, being able to afford being inducted. I can't stand the idea that somebody who is eligible to be nominated just can't afford to be inducted. That I'd love to see that not be an issue. And being able to see lots of activities. For example, we are planning a field trip to the United Nations to have opportunities for our members to grow and become involved in scholarly activities, and to also partner with our mission and engage in the community, in community service. So I'd love to see all those things happen and to get our name out there, and also for nurses and all to know what Sigma is, for each and every nurse to know.
Actually, for folks who maybe are pre-nursing, so we have some listeners who aren't even in nursing school yet, could you talk a little bit about what Sigma is?
Sigma is an international honor society of nursing, and its goal is to promote the leadership of nurses. To be eligible, typically you're a senior in your nursing program, you can become inducted at your BSN program level, or also at a master's degree or doctoral level, or you can be a nurse leader and become inducted that way as well. You don't have to be a student. And depending on the chapter, you can become engaged with whatever activities they have. You can actually become a member of multiple chapters if you choose to. And there are a number of ways to network, whether it's through the Circle, which is a website for Sigma members, or being involved in local events, or even their biannual convention, which happens every other year, and as well as annual international conventions every summer. So there's a lot there to become involved with.
That's such a cool way for nursing students and also for nurses who are out practicing to just stay involved in the community, network, see what it's like, have conversations with nurses in different healthcare systems. Because again, we're a community and the practice from one place to another is different, and we're always growing and we're always learning. So being involved in these professional orgs is such a great opportunity. So thanks for sharing about that.
Thank you.
Daria, thank you so much for your time and for sharing your experiences. That was such a wonderful conversation we had, and I'm so thankful for the opportunity to just pick your brain about the nursing education route, because that's still something that so many of us are interested in, and at the same time is such a big need. Thank you so much for sharing, and everybody will see you next time on the Nursing Insights podcast.
Thank you, Stephanie.
Thank you so much.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.